FAC, I know, are extremely grateful for the amount of work that all the different provinces and territories have put into this. You might think that handing over your data is simple. You copy it onto a memory stick and give it to somebody. But actually it doesn't work like that because, of course, there are variations in how people get diagnosed in different provinces, where people set the threshold, what sort of data is collected. So FAC have had to put in a huge amount of work to try and make sure that data from different systems truly is comparable with each other within the limits of their budget. This is data gathered from all over Canada. It's based on data from 2015, in part because it usually takes a couple of years to go through the data and get it into the sort of shape that can then be used by FAC. The data is from those 7 provinces, but with the expectation that within another 2 or 3 years, and certainly by the time of the next report, all the provinces and territories will be participating. So the current data is not from every child with ASD in Canada. It's from about 40% of the population, but there's no particular reason to think, at least from a provincial level, that is unrepresentative. I think there is a lot of concern that often doesn't get talked about whether for particular ethnic groups there may be gross underrepresentation. So we know that across Canada, if you're from a First Nations background, the chances of you getting an ASD diagnosis are much less than if you were from a Caucasian background. And similarly in Vancouver, where we have a high immigrant population, we know that there is underrepresentation of diagnosis amongst particular groups of immigrants. The data that's published in the report is simply numbers, but FAC does have a lot of data that they are wading through in terms of intellectual disability, presence of other diagnoses, other medical conditions, and I think we can anticipate that over the next few years that data will be published. So the average prevalence for 5 to 17-year-olds in Canada is 1 in 66 children, which you can see is broadly in line with the data from BC. And not every province has such a sort of scrupulous way of diagnosing ASD. The sex ratio is pretty much in line with what William was presenting yesterday, basically 4 to 1. And you can see that where there is longitudinal data, so the BC data actually isn't included in this, but I've already shown it to you, but you can see the data from the other 3 provinces looks absolutely identical to the BC data. In other words, there's a year-on-year increase in detected prevalence. And the rates that are being reported in Canada are actually extremely close to the rates that are being reported in other countries. And sometimes you'll see in the press that people will sometimes get agitated about a rate of 1 in 66 in one place and a rate of 1 in 62 somewhere else. That is not a meaningful difference in rates. So the errors in the data are so big that most professionals take the view that the rates of ASD are broadly comparable in all the developed countries that have bothered to count. But there is significant variation in diagnostic practice across Canada. So the rates are actually twice as high in Newfoundland and Labrador as in the Yukon. That needs further investigation. The clinician in me thinks that's likely not to be true in terms of the true underlying rate, but if it was true, it'd be very interesting. Why would there be a twofold difference in rate? But we can come up with other explanations why there might be these variations between provinces. And you can see the British Columbia sits pretty much in the middle of the range. And in addition to these differences in prevalence rates, the sex ratio across the provinces varied from 1 to 3 to 1 to 5. So within that range that William was describing yesterday, which I think is telling us that some provinces are probably not yet identifying all the girls affected by ASD. In my adult clinic, my sex ratio is about 1 to 1. Recently, it's shot towards over-referral of females, but I gather there are one of my patients tells me there are social media-based reasons for why I'm being inundated with women at the moment. But even prior to that sudden shift, it was obvious to me that I was seeing a much higher rate of women than we normally would think about, and my interpretation of that was that the most able girls were reaching adult life without a diagnosis, so very much in keeping with what William was saying yesterday. So I think that this is a really solid start to have finally got some data from across Canada. The variation, I think, is telling us that there's probably a lot of variation in diagnostic practice from one area of Canada to another, and probably within provinces. This is to do with the level of sensitivity of clinicians in different areas. And I think some of the most interesting data is yet to come in terms of really understanding the fine detail of this work in terms of the levels of intellectual disability, the rates of other psychiatric disorders. And I think at some stage in the future, if sufficient pressure can be brought to bear, we really need some estimate of the rate of ASD in adults. It is unlikely to be cross-Canada data because that would be too expensive, but it probably is doable to get an estimate from a more defined region. So I'm going to stop there, and we've possibly got time for a couple of questions.